With close to 7,000 deaths, Italy is the nation hardest hit by this coronavirus pandemic. And as Nick Schifrin reports, Italy's doctors are urging the United States to learn from their national tragedy. And a warning, these scenes are difficult to watch.
In northern Italy, the patients are gasping for air. At hospitals across the region, the horror is relentless. And the doctors and nurses who don't have enough protective equipment, don't have enough beds or machines, don't have enough hours in the day to save the sick, say they're losing a war.
We are at the end of our strength. This is a small hospital, and we are taking in a lot of people. I would say the capacity is finished.
Dr. Romano Paolucci was called out of retirement to help treat COVID-19 patients at Cremona's Olio Po Hospital. Doctors are pulling 12-hour shifts, and they're starting to get sick. 6 had to leave work after contracting COVID-19.
Psychologically, it's very difficult.
Nurse Luca Dall'Asta struggles to find the words.
It will be at the end of this emergency that we will see how we stand up. But at the moment, we have the right spirit, even if we are very tired.
Doctors call the treatment for COVID-19 intense and lengthy. Patients need weeks to heal, if they heal. There are only so many ventilators, and they're prioritized for those most likely to survive. And so doctors are forced to decide who lives and who dies. And when patients die, they die alone. Funerals are illegal. Coffins sit for days. In this chapel in a crematorium, there are 3 times the normal number of dead.
In theory, we are used to this because our job deals with coffins. But now we understand the exceptional nature of the crisis.
In Bergamo, the cemetery is full, so army trucks brought coffins to a cemetery in a different region, far from victims' families. This is one of Europe's best healthcare systems, but in Brescia, the hospital admits COVID-19 is overwhelming. There are so many patients awaiting their COVID-19 tests, they wait in cots in the hospital laundry room.
What is really shocking, something we had not been able to forecast and brought us to our knees, is how quickly the epidemic spreads.
Elsewhere, the streets and Italy's most famous sites are empty. Rome, the eternal city, seems frozen in time. But critics say that isolation came too late.
This was a missed opportunity.
Dr. Andrea Crisanti has been watching the virus ravage Italy since the first death in the tiny city of Vo on February 21st. Local officials lock Vo down, and Crisanti's team tested all 3,300 residents. That allowed authorities to curtail infection at the earliest signs.
Now, with the experience that we have in Italy, you really need to bring the place to a standstill. Nobody moves for 3 to 4 weeks, and you do test as many as possible around the place where the clusters appear. There's no other way.
Crisanti's team brought the infection rate in Vo to 0, but he said Italian authorities didn't learn his most urgent lesson.
Nobody has ever won a war by building more hospitals. You have to build more weapons. And I think the weapon to win an epidemic are measure of containment and surveillance and tracing. I regret that I did not use my scientific approach to challenge consolidated wisdom. Because, I'm a scientist. I try to convey in a polite, educated way. Probably I should have been more aggressive.
Despite all the fear, Italians have tried to maintain their hope. Despite their separation, they've maintained their connections. In a Lombardy hospital, Dr. Sara Barbuto used a megaphone to play the Italian national anthem. Doctors sang along through their exhaustion.
I wanted to tell you that in all of Italy, people are thinking of you. They're hoping that we will win this very tough battle. I am sure that is how it will be.
Outside another hospital, there's a mural. A nurse holds Italy in her arms. Dr. Crisanti wants the U.S. to avoid Italy's mistakes.
I think they have to take this very seriously, and I think they have to be ruthless in their effort to block the spread of the disease. Ruthless in terms of measures and in terms of resource to pour into it.
But for now, Italy's doctors have a warning. Get ready. Your country may be next. For the PBS NewsHour, I'm Nick Schifrin.